Tonight.
Obesity does run in the family, but my highest weight I was up to 280 pounds.
An ABC 27 special presentation.
It was not easy being large. I justified my eating because I don't drink, I don't smoke, I wasn't out partying.
Penn State Hershey Surgical Weight Loss presents The Wait is Over, Exploring Surgical Weight Loss. Brought to you by Penn State Milton S. Hershey Medical Center.
Good evening, I'm Chuck Rhodes. Obesity continues to be a major concern in the United States for the young and the old. Tonight, specialists from Penn State Hershey Surgical Weight Loss are in the ABC 27 call center to answer your questions. Call the number on the bottom of the screen, or you can email your questions during the show to questions@abc27.com. Bariatric surgeon Dr. Jerome Linsu will answer your emails throughout tonight's show, and keep in mind all calls and emails are confidential. Here's Debra Pinkerton to share one patient's story. Debra?
Thanks, Chuck. A York County woman was diagnosed with high blood pressure and high cholesterol in her 20s, some very serious problems at such a young age. Her weight was to blame. It's a victory for Liz Eichholtz to walk through these doors. It's even a bigger accomplishment for her to actively participate in this hour-long class.
It's a lot of high-impact cardio, but along with the weight training as well, which is what I'm looking forward to, strengthening my muscles.
Physically fit now. Liz could not say that about herself 2 years ago.
I could not even imagine myself coming to the gym. I didn't have a lot of self-confidence as far as working out in front of people, and I was very embarrassed.
Embarrassed by her weight, Liz weighed 280 pounds, a weight problem that started when she was young.
I always remember going to the doctor and pediatrician always saying, get her to try and, lose a little weight.
After high school graduation, Liz recalls the pounds adding up. It was around the same time she met her soon-to-be husband.
Weight was never an issue when I met Liz. It was more of I liked her personality. She was always upbeat, always positive about everything. I was looking at her for her and not for her body.
So much positive energy, Liz lost weight for their wedding.
My dress actually had to be taken in 2 sizes, so I was very proud of that, but I was still overweight.
Over time, Liz gained back the weight she had lost and then some.
I think my main issue was the portion control and the convenience of, fast food, that kind of thing.
Throughout the years, started to notice that, she's not wearing her shorts like she used to wear. She's still happy, but she wasn't maybe doing as many activities as she would do.
Liz developed a number of health problems, high blood pressure, high cholesterol, and frequent migraines. But it was a very personal issue that forced her to seriously think about weight loss surgery.
My husband and I were trying to conceive, and we were not successful. So I met with the OBGYN. She said, there's nothing wrong with you, technically. She did say, that it's strictly a weight-related issue. And she told me if I would lose just even 10%, that I would most likely gain my fertility back. After hearing that, I was like, okay, I really do need to do something.
Liz didn't have to look far for help. Her father had weight loss surgery, and so did a number of her other family members and friends. But the person closest to her did not agree.
I was kind of against the surgery when she told me, because I was more along the lines of, if you just go to the gym and exercise and do what you got to do, you'll see the same results.
After failing so many times with dieting and exercising, Liz knew surgery was the only answer. So she enrolled in the surgical weight loss program and met with psychologist Dr. Andrea Rigby.
Her attitude was, I want to lose weight, but I come from a family of overweight people. And I know that I have developed very poor eating habits. I need to make changes in my life, and now is the time.
Liz made significant changes and lost nearly 20 pounds. Then it was time for Liz and Tim to meet with bariatric surgeon Dr. Ann Rogers.
And my husband said he never knew how much I weighed. I never told anyone. And when we went to meet with Dr. Rogers, they make you get on that scale like every time you're there.
When she stepped on the scale and I seen the weight that was reading on the scale, I thought, oh my goodness, I didn't realize how bad it had actually gotten. Something needs to be done, if nothing else, at least for her health.
She was a candidate for any of the kinds of surgeries that we offer, but she was pretty determined she was going to have the gastric bypass, and I agreed with her that that was probably the best choice.
Now Tim agreed.
I was behind her 110%, and I decided, if that's what she wants to do and if that's how she wants to, pursue it, I'm all on board.
Surgery was scheduled.
She had a laparoscopic gastric bypass. That is the most commonly performed operation for weight loss in the world, and certainly in this country. It's done through small incisions. It requires making a small pouch off of the top of the stomach and making a rearrangement of the intestines and hooking them up to the pouch so that you can't eat very much, and what little you do eat takes a different route.
Afterwards, the healing process went smoothly also. Didn't feel any pain, nothing uncomfortable, so it wasn't as bad as I thought it was going to be.
Shortly after the surgery, Liz lost weight. It was almost like the pounds evaporated.
In the first couple weeks, you lose, I would say 1 week I had lost 8 or 10 pounds.
After the time progressed and I started looking at her, and it's like, yeah, you can start to see the clothes are getting different.
I told him, I said, I was in a size 24 and now I'm down to a 10. That's really a big difference.
Oh, she has had a wonderful result. She really has been a great patient. She sticks to the rules, she follows the diet, she exercises like crazy, and she's actually lost a lot more weight than I would have expected.
With having lost 130 pounds, that's a person that I lost, basically. So now it's just I feel like I'm so light and I have so much energy, and it's just, I feel young again.
It's been a big change in my life because now I have a friend and a loved one that I can go hiking with, that I can go to the tennis court and play tennis. Whatever I choose to do, I know that she's going to be right beside me now, which is a huge thing, made us both closer.
A very happy ending. As you can see, Liz loves being active. She's healthier too. Her high blood pressure dropped and her cholesterol is normal. As far as starting a family, Liz says that is in the future. Chuck, back to you.
After a great start. Now joining us, Dr. Ann Rogers, you saw in that report, the Director of Surgical Weight Loss. Doctor, we talked in the lobby before the show, and I know a lot of people are curious, how safe is this kind of surgery?
I think there have been a lot of horror stories in the past about bariatric surgery, but a major national study has shown that now bariatric surgery is as safe as gallbladder surgery. That's very safe.
So there's no fear coming into it, but maybe some confusion. They hear things from somebody told them, that type of thing. Now, in the story, I thought this was interesting. You said you're able to almost predict what a patient will lose. What's that based on? How does that work?
On average, a very good result from bariatric surgery means you'll lose about 1/3 of your starting weight. So that means if you weigh 300 pounds, you can expect to be about 200 pounds with a good result. Some people lose a little more, some people lose a little less, but that's about what we expect.
Do they ask you ahead of time what's reasonable? Are they curious?
Some do, and some set a goal for themselves, and I never discourage them.
Well, right off the bat, you want to ask yourself, what are the benefits to those who qualify for this weight loss surgery? There's got to be a list, a big list right off the top.
Well, most of our patients have a very long list of associated medical problems, and a lot
because
of them
of the weight.
Based on the weight, and a lot of them will clear up very rapidly after the surgery. One of the first things to go is sleep apnea. Patients love that because they're not using a machine to help them breathe at night.
Very quickly, why sleep apnea for weight?
A lot of our patients carry a lot of weight in the neck and in the throat, and that's one of the earliest places to lose weight. So sleep apnea goes pretty quickly. Another thing that tends to go away with the gastric bypass in particular is diabetes. And studies have shown that about 85% of patients either improve significantly or have their diabetes cured immediately after bariatric surgery.
It sounds like it's a win-win the whole way through there.
It's amazing.
All right, at this time we're going to check in with Debra Pinkerton in the ABC 27 call center. Debra?
Chuck, the phone lines have been very busy. If you would like to talk to a specialist, the number to call 346-3333, or you can email your questions to questions@abc27.com. Now, here to answer our first viewer question is dietitian Janelle McLeod, thanks for being with us. Here's the question. I thought about having weight loss surgery, but I'm afraid I'll fall into my old habits of eating too much. I'm always hungry. Will that feeling go away after surgery? And is it possible to put the weight back on afterward?
The feeling of hunger may decrease temporarily after surgery, which will help with weight loss. However, some people who lose weight initially after surgery may experience weight regain several years down the road. We have found that our patients who have achieved long-term weight loss success have incorporated the healthy eating, exercise, and behavior strategies into their daily lifestyle routine. They also tend to have a strong support system and follow up regularly with us.
Okay, thanks so much, Janelle, and we'll talk to you just a little bit later, but we will be right back. Stay tuned.